So I'm Dr. Juliana Chan. On behalf of the organizing committee, I would like to welcome all of you to the Diabetes Prevent the Preventable 2018. This year, we have invited overseas and local speakers to share with us a broad range of topics, including dietary management, holistic management, and also drug management.
Today, through the format of panel discussion, we, including doctor, nurse, and patient, share the concept of new care model, including peer support to help difficult-to-treat patient, type 2 diabetic patient with obesity, and hope through this new model, including peer support element, to improve diabetes care.
Dietary therapy for diabetes is tedious. Many of my patients complain that sticking to particular meal size and particular compositions is extremely difficult. Having heard these complaints, we wanted to come up with dietary therapy for diabetes, which patients can easily follow. That turned out to be a meal sequence.
The fracture risk in diabetes is much increased, with increase in type 1 diabetes more marked than type 2 diabetes. In type 1 diabetes, there's reduced in bone mineral density, while in type 2 diabetes, the bone mineral density is usually increased. However, the fracture risk is increased despite of the increase in bone mineral density.
So in Hong Kong, as in many parts of the world, the prevalence of overweight and obesity is rising, and currently about 50% of our adult population are affected. In addition to lifestyle intervention, there are a number of drug therapy that are available to help us to tackle this problem, of which liraglutide, which is an injectable therapy, holds promise in both weight losing efficacy and acceptable safety profile.
There is no one diet fits all, and there is still a lot of questions about different diets on the impact on the diabetes control and obesity. So before you choose any diet on your control of diabetes and obesity, you have to balance between the pros and cons on each diet and the effect of each diet on the disease itself.
When the patient have a good shelf management, they can have a balanced diet, adequate physical activity, control their blood glucose well, and reduce the complications and have good quality of life.
We know that with newer agents such as GLP-1 analogues, use of newer basal insulins, and also new technologies such as real-time continuous glucose monitoring. With these measures and combined, we might be able to reduce glucose variability. However, there's still a lot to be learned regarding the roles of glycemic variability impacting long-term both patient and complication-related outcomes. So I think a lot more studies are needed to answer these questions.
I think this serves as a wonderful platform for us to learn the most updated management of diabetes, and also give us great opportunities to share ideas and knowledge among different specialties like nurses, paramedicals, like podiatrists.
I've been joining DPP for a few years now. It covers a lot of topics which are very relevant to my daily work. Especially the nutrition topic this morning is very good. It inspired me looking into new aspects in managing my patients.
This is my first time to attend the DPP forum. I find it quite interesting and very instructive. DPP forum covers various fields of clinical care in diabetes. So it's a very instructive and good conference for diabetologists, endocrinologists, and also GPs, and also co-medicals.
This forum not only to talk about how to prevent diabetes, but also how to treat it, to care it, and also in a multidisciplinary approach with, say, dietitian, researcher, and doctors, and also from overseas speakers to share their experience with us. And it is a really good forum. Yes, do join us next year.
So I hope you have found the program useful, informative, and enjoyable. And I look forward to meeting you again next year at the Diabetes Preventing the Preventable Forum 2019.